So a special welcome to anyone who's joining us for the first time. My name is Joan Frizz. I'm the Executive Director at Just Creations. And we conceived of this program to offer fair trade information and education in an informal setting. And Zoom allows us to reach people near and far. I hope that you will be inspired by our presenters tonight and will want to continue to explore fair trade topics with us in the future. We offer this program on the third Thursday of each month. And if you would like to support this and other educational outreach programs with a financial donation, you can visit our website at justcreations.org, click on the donate button, and I think Pat's going to put that in the chat tonight. It is my pleasure to introduce our speakers this evening. Not only are they fair trade partners of Just Creations, but I consider them friends. They have allowed us to visit their offices, donated to special events here at Just Creations, and spoken to several groups as part of our education programs. Kristen Johnson is one of the founders of Global Mamas. Founded in 2003, Global Mamas is on a mission to create prosperity for African women and their families. Kelly Weinberger is the founder of World Finds, an ethically made jewelry and accessories brand, offering artisan made and sustainable style while empowering women in their communities in India. World Finds is celebrating its 20th anniversary this year. Did I get that right, Kelly?
You did, spot on.
Okay. So as we in the US begin to loosen restrictions brought on by the COVID-19 pandemic, many countries around the world are experiencing a second or even third wave. And especially in poorer countries, the people are still suffering. We have invited Kristen and Kelly to speak to us tonight about the impacts of the global pandemic on artisan communities in Ghana and India. Before we begin, just a couple bits of housekeeping. We'd ask that you keep your microphones on mute. During the presentations, Patrick will be monitoring the chat, so if you have any questions, please feel free to drop them in the chat box. After both and Kelly have spoken, we will open it up for questions and discussion. So without any further ado, I would invite Kristen to, I'm going to stop sharing my screen and invite Kristen to share her screen and begin her presentation. You're on.
Thank you. How many times have we all done that over the past year? Start talking with your mute on. Thank you, Joan, for inviting us to be here today. And just to everyone in the Just Creations community, we're not at 20 years yet. We're almost there, but Just Creations has been a partner for Global Mamas since the very beginning. And I would venture to say probably we wouldn't be here if it weren't for our strong partnership with Just Creations in the first few years. And then you've just continued to make us stronger and stronger. So thank you for that. All right, I'm gonna share my screen. I wasn't sure what order we should go in today because the story that I'm gonna share about Ghana is quite a bit different than the story that Kelly is gonna share. But the interesting thing that's happening in Ghana with, in terms of COVID, and I have this graphic, is that COVID has not hit Ghana. So this is a statistic as of today, but they've had a total of just under 100,000 traced cases, you know, like actually documented, and only 790 deaths. And it's been a miracle. And when you think about everything that you know happens in countries struggling with poverty, to not have this extra layer on top of things has been wonderful. West Africa went through the Ebola pandemic epidemic a few years ago, and that was, we know how awful and horrible it can be. But Ghana did a lot of things right away. I think probably having learned a lot of lessons from Ebola, So they immediately shut down the borders, and they also immediately locked down the greater Accra region where they were starting to see cases pop up. And it was very obvious that COVID was being imported to Ghana on international flights. So they also closed the airport. And, as an organization that ships all of our products via air cargo, having the airport completely closed for 3 months was, we were just always living on edge, wondering when it was going to open up again. And there was no good information on that. They also had a very robust testing system right from the beginning. And I think that really goes back to lessons learned through Ebola. And one of the stories that came out of Ghana right in the beginning is that to move samples, I guess, quickly to the testing centers around the greater Accra region, they were even using drones. And so what I marveled at that time was looking at what Ghana was doing and comparing it to what we were doing. And, it was interesting and shocking, but also kind of made my coworkers really proud that they reacted so much more quickly and stronger, and they really prevented COVID from spreading in Ghana. One of the things that people have been talking about over the past year considerably is why is this happening in countries like Africa and, I know Africa's not a country, the continent of Africa, but many countries in Africa, but also it was Asia. And as I was reading articles about why this was happening in Ghana, these really low rates were also happening in India. And I'm sure Kelly is probably going to talk about that. But there was a New York Times article that I read, and I don't know if you guys subscribe. If not, sometimes you can see an article or two for free. Looking for the chat. I'm going to put this link in there. If anyone wants to look at it, but they talked a lot about several factors, but the biggest one is that the population in countries like Ghana is really young. And so you didn't have, and then you also don't have people living in nursing homes because in Ghana, your extended family lives with you. And they just don't have that kind of structure built up for elder care. So we didn't have a lot of older people all congregated together. And so that was considered as one of the reasons that Ghana escaped COVID passing so quickly. The other thing is that it also, everything's done outside. The article talked about fresh air is everywhere, but people don't have air conditioning. Windows are always open. All the markets are out in the open. Cars often don't have air conditioning. So you've got windows open on buses and public transportation. And I think that probably is a huge factor as well. And then there is some theory that in general, immunity is probably stronger in a country like Ghana. They're exposed to a lot more than we are here. And so that also may have strengthened their ability to combat COVID. So the great news that I'm starting my presentation off with is we're healthy and we have not experienced anything like what the United States or India has gone through. Unfortunately, economically, that hasn't, it's the impact of the global pandemic has still really hit Ghana and global mamas in a very significant way. One of the things we realized and talked a lot about during Ebola was how happy we were that we had diversified our marketplace so significantly. So about a quarter of our revenue is generated in Ghana at our fair trade store in Accra. And then the other 75% of our revenue is spread out amongst Europe, North America, and Australia. And so when something regional is happening, you don't feel the impact of it so significantly at Global Mamas. But with the global pandemic, every aspect of our operations took a hit. And I'm going to talk a little bit more about that in a minute. Are there any questions before I move? Or you wanted to wait till the end, right, for questions? Okay. So the other thing that I learned last year, and that we all learned, is that community matters, and being in a fair trade community, I think, saved our lives. Like, there's just no way that we could have made it through 2020 if we hadn't had every aspect from our retail partners and our donors, our employees, our mama producers, and pretty much everyone we know coming together to say, how can we help? How can we get Global Mamas through this? One of the biggest things that happened is that all of our retail partners, we're very seasonal in a different way than most fair trade wholesalers. We don't have a bunch of, or fair trade stores even, we don't have a bunch of our sales at the end of the year focused around holidays. So much of our sales is driven by our very seasonal clothing. And so the first quarter of the year and then the second quarter are really kind of like March, April, May are the biggest 3 months for us. And so our stores had already placed their orders for their spring apparel, whether they'd already just received an order or were just about to get an order. Almost everybody agreed to take their order. And that was, to me, just amazing, knowing all these stores being closed down, not knowing when they were going to open up again. Almost everyone took their orders, and that gave us the cushion that we needed to get through the summer. We had donors step up to help support as we did have lockdowns in different communities, especially in Greater Accra, and people weren't able to come to work. We set up food stipend programs and supplemental payments because Ghana has no unemployment insurance, no stimulus checks. There was no support for anybody, whether it was our mamas or their extended family members. As businesses were shutting down, tourist businesses were shutting down because there were no tourists, and all of that industry that supports it, and a lot of the markets were shut down, so people that sold in the marketplace weren't getting their income. And it was amazing to be able to say, Global Mamas, we're going to take care of you, and if anyone needs help with food or just meeting basic living expenses, we've got support for that. And then the other thing was how our Global Mamas community came together to say, okay, this is going to hurt. This is going to be a hard year, but we are all going to do it together, and we're going to share in the pain equally. And so everyone across the board agreed to pay cuts, and everyone across the board agreed to moving orders back and forth around locations, depending on who most needed it and which mama group most needed the work at the time. And we didn't end up having to let anybody go. We all, lost some part of our income, but we did it together. And I was so proud to be a part of this community and to get through it together, even though there were times where I wasn't sure we were going to make it. Knowing that we were all in it together made it so much easier. Okay. I think I've covered all of my points there. Just to give you an idea of how our sales were impacted, we tracked it in 3 major ways, and we track this for the entire organization. We have a monthly dashboard that we all look at, and it tracks how, our different goals. So our sales goals for the year and how we're doing with our quality goals. Every location has a specific goal for the year, but we created the virus dashboard as part of our dashboard. And one of the things we were looking at is how our sales were tracking against the year before. And so you can see by the end of the year that our European customers actually ended up doing more with us than, and these numbers here are thousands. So they ended up doing just as well as we did in 2019. In the US, we were down a lot more. And, what was happening there, of course, is that Europe wasn't hit as bad as the US was, and they opened up for the summer, for part of the summer. And so a lot of the stores were actually even able to reorder apparel. But this piece, losing our revenue in Ghana with the airport being closed down and not having any tourism income, was significant. So in total, we were down about $400,000 from where we normally would be. But so, if that had been the end of the story, I don't think we would be here today. But we pivoted to masks. And I think this is probably true for a lot of fair trade companies. Since we are all friends here, I will go on record letting everybody know that in June of last year, I was quoted as saying, "We are not going to make masks. We do not want to get into mask making. There's so many masks. It's not going to be needed." But fortunately, no one listened to me, and we started making masks. And we first were making them for Europe. And so the European sales that you see there, a lot of that was made up through masks. And once we saw how successful they were there, that's when we started bringing them over to the US. So in total, we exported 29,577 masks to Europe, Australia, and North America. And then we also got a grant from the German government to make masks for Ghana. And that also, was amazing. And we started sewing like crazy. And we produced 90,994 masks for different groups in Ghana. So it was we sent a lot to healthcare facilities. Our masks in Ghana were a little bit thicker than what we exported, and then they were approved by the FDA in Ghana. So they were able to be used in medical facilities. So a lot went there. About 50,000 went to schools because they did get their schools going back pretty quickly and obviously wanted the kids to be together. So the kids were wearing masks. And then a lot of churches, and then individuals just for, riding on public transportation and times where they couldn't social distance. I do want to let you know that our grant was supposed to cover us to make 200,000 masks for Ghana. And by December, we realized that the need for masks in Ghana and the market for masks in Ghana was not going to be able to sustain us fulfilling this grant. So we had to leave €100,000 on the table and actually give it back to the German government because those masks just weren't going to be needed in Ghana. And so that is the end of my presentation. I hope I didn't go over my time, which is a bad habit of mine, but I'm excited to hear, I don't know, Kelly, I don't want to say I'm excited to hear what you have to say, but I'm looking forward to hearing your update. And then if people have questions, I'm available.
Thank you, Kristen. We'll save the questions to the end. Thank you for all the numbers. I love numbers. So we'll turn it over to Kelly.
Unmute. Thank you. Let me switch screens here. And then I will go to, okay. Everybody can see the photos, okay? Okay. Why? Does anyone know how to prevent it from moving until I click?
When you are doing a slideshow through that, it's an automatic slideshow. So you're going to have to go to the picture and then pause it. Yeah.
Okay. Gotcha. Okay. So, yeah. So I'm going to be, so thank you. First of all, thank you, Kristen, very much it's really interesting to see how the different countries have sort of rallied and, just how very, very different all of us and here compared to, multiple places have handled the COVID situation. So I thought I'd start out with, as far as COVID in India, what it is like in the before times. So again, India has a population of 1.4 billion people. We work primarily in the New Delhi area, which is, very super population, super dense. And this is just a photo from a recent visit. and just, to get an idea of just a lot of people crowded into small spaces. And that is just like a normal, what would be a normal thing in the before times. This would be us, meeting with, the artisan team, putting together, new designs and, working on logistics issues or production or things like that, all of this in the before times. Again, we kind of bring in, all the artisans from surrounding areas for a photo opportunity, and this, lots of people, crowded spaces. You kind of get the idea of what it was like. This is the artisans at their typical workstations at one of the workshops. They also do work at home, so that was a blessing for sure the past year. But again, fairly crowded, close together workspaces. You can kind of see how, it all works out. And then, of course, March 2020, COVID hits. Our little team are all at home working on Zoom, trying to figure out what's possible to do with, everything shut down and all of our retail partners shut down, and coming up with projects that could be done and figuring out what we could do to all just sort of stay alive. It figured from a business perspective, from a healthcare perspective, everything like that. And then in India, and again, they were not hit as hard right away as the States was. And so they rallied immediately and did a whole bunch of food distribution programs. So one of our artisan partners, Tara, that does a lot of our metal jewelry and our cause bracelets and things like that, they're a longtime member of the WFTO, and they, rallied immediately and started doing food programs. They sort of, transferred all of their facilities into, resources. A bunch of the partners in the States, put a GoFundMe together to get extra donations to them. We donate on top of sort of the fair trade work. We do send donations through a couple of our cause bracelets to Tara. And so all of those helped get funds to put, all the food together. There's a lot of migrant communities that just didn't have the opportunity, didn't have the resources to go out and get food. So they were preparing these food packages for them during, the initial few months of COVID. So this is all like early mid 2020, where they're putting the food together. The artisan groups, instead of making jewelry, they're prepping food packets and things. And then distributing them, getting them to people's homes where they can't leave. They're setting up, having the artisans distribute the food where it was safe and all outside, things like that. Getting the larger food groups to people. And and so that was the first few months. And when they couldn't really go back into the offices to work, then it kind of calmed down a little bit. They were start to go back to work. So they were probably at, I don't know, maybe 50 to 75% capacity back at work. And then we asked what we could do for the next phase of help, and masks. Like Kristen, I think some words that came out of our mouths were, we don't need to do masks. There's a lot of fair trade masks out there already. The world doesn't need any more masks. Of course, we're preparing a special project initiative for Fair Trade Month. And so in July, we did ask the artisan partners, like, what can we do this year to help you? We usually do a special project, and they're like, buy masks from us. And we're like, really? Are you sure? And they're like, yes, our sewing group is up and running. We need the work. Please order masks. So we decided we would order masks, but 100% of the sales would go back to them for these additional projects that they're working on. So that's what we did. So we put a bunch of orders of masks in for the, the cotton masks with the little filter pocket and things like that. And then that was our project for Fair Trade Month. And then those sold out immediately. So we did another batch, and then we did a third batch after that. And, with all of the sales from not, going directly back to the artisan group to fund whatever they need, more food help, more other, whatever projects that, they needed. And so that sort of took us, to the end of 2020, again, they were back up and working. They were able to, start producing some of the orders that we had. Same thing. I feel like our fair trade, our independent store community for sure saved us and our artisan partners throughout, 2020 of COVID. Everybody stuck with their orders. Everyone, wanted to know how to support us, and we're amazing with taking pre-orders that they had done, and just continuing to stick with us and understand the difficulties. Everything was late. I mean, we're just thrilled to get anything in. Our normal collections wouldn't look like they would in a non-pandemic year, but we were just thrilled to have something. And again, things were looking up. The numbers in India had been very low, considering the population and considering so many factors of just life in India. It was amazingly low. And they were, even in January, we were having, Zoom calls. Everybody thought at that point they would be back to full capacity by March of the year. And so there was just this sort of underlying feeling like, oh, great, things are really returning. It's amazing. It didn't really hit India. It's all good. And then these are photos we got from our artisans for how they're celebrating Holi this year, which is the Festival of Colors. This year it fell on March 29th. And the artisans were all still, wearing their masks, social distancing. There's a really cute picture of a little girl with her colors from Holi. We got these pictures sent to us about a week and a half after that. And about 2 days later, which was April 16th, we were told that they've been told they're going to be put on a lockdown for maybe a week or two, just to kind of slow the spread. And as of today, they're not really fully back to work yet. It's been just devastating and horrible and horrific on a level that I guess in some ways it's not unexpected, but I think so many people thought that they had made it through this far. The guard got down a little bit. So, as far as what caused India's second wave, a lot of factors contributed. And again, the second wave really started building mid-March, and then really, was clearly, at a peak level by that mid-April, where the government, did a hard lockdown. And again, our artisans are in the New Delhi area, so super concentrated. And so full solid lockdown happened then. The virus was the super spreadable virus that, we didn't have here when the numbers were so bad in New York City, like a year ago. So it's just spreading at a rate that's just crazy faster than, what the States had when it was, spiking at its peak. Also, they had a couple festivals like Holi, was in mid-March there, and or late March. And then there were a couple political rallies where people were together in large groups. They weren't social distancing. People weren't wearing their masks. I think the common, one of the reasons is people's guards seemed to have been let down a little bit. They weren't being quite as rigorous as they had been. And all of these factors contributed to just a crazy spiking in cases in a really short amount of time. And unfortunately, India's healthcare system is so fragile that they were not prepared for it. There were not enough oxygen machines. That was really the number one thing. The hospitals were overloaded. There were not enough beds for people. It just turned into like sort of an unimaginable nightmare, and just really horrible over there. And just everyone, we were in touch with the artisans from, just on WhatsApp, just regularly checking in with them. And I mean, just everyone has lost family members and neighbors, and it just hit at such a horrible level, and nothing could be done. It was just sort of mass chaos. So we were feeling incredibly helpless. We weren't sure what to do first. So we immediately researched organizations on the ground in the New Delhi area that were able to provide oxygen concentrator machines. We tried forever to try to source them here and get them sent, but with different electrical bases, we weren't able to find the right thing. We thought, well, let's just concentrate our funds on organizations on the ground in India, nonprofits that were getting these machines. So we tried to share a list of that with everybody here to kind of help support them that way. And it's just been really slow going, and really horrible and devastating. And it's just, you feel so helpless over here, and you're trying to do everything you can. And it's so bad that, and the numbers that were getting reported in the news, everyone we were talking to saying that the numbers in actuality were probably 10 times worse. But you had to have certain things in place to get counted as a COVID death. So a lot of deaths weren't getting reported as COVID, which were actually COVID deaths. So just the situation on so many levels, it was just not equipped to handle everything over there. So that's been going on now since mid-April. Finally today, I got an email from one of our groups, and they've slowly the numbers have been going down, which is great. But they're still very fearful of a third wave. And of course, the vaccines just are not available there like they are here. And the international community has been a little slow to respond to the gargantuan need over there, getting as many vaccines over there as possible. So it's absolutely getting better. It's just slow going. And it's just been really tricky because we, as much as we want everybody to be back at work, because we get, it's like the tale of two cities, right? Because America is so open right now, and stores are open, and people want product, and, and we are just like, please live, please, stay strong, stay safe, stay in your homes. As much as we would love you to be working, we want you alive and safe, and, don't go out there. So it's just been tricky, and little by little, things are getting better. Numbers are going down. They're feeling safer going out. There still are not enough vaccines. It's calmed down to the fact that the healthcare systems are less overrun, but a lot of flaws in the system have been highlighted because of this. And so our artisan partners have asked us for additional aid to help set up some healthcare facilities in some of their more remote regions where some of the groups are, and then just to perhaps purchase some oxygen concentrators to have available in case needed for future things. One of our little small artisan groups that do our bags, it's a small family group. They had a really tragic situation there too, with the founder getting COVID on top of diabetes, and he had to have his leg amputated. So it has just been 2 months of just horrible stories and feeling just so helpless over here. So we did create a fund for getting aid to some of these organizations directly to the artisans. So we do have a link to that on our Instagram bio for anyone that wants to contribute to some of the funding for these special projects, and also to the artisan family to help with recovery costs with the amputation and things like that. So that we have going on still. And little by little, they are climbing out of it. Of course, everybody wants to get back to work as soon as they can, as soon as it's safe. They're so resilient, and they've been extremely strong and brave throughout this whole situation. And it's finally getting better. I was really hoping, I didn't want to end today, on a completely devastating note. It's been really difficult, but they're finally feeling better. The cases are going down, and we're just really hopeful that the international community continues to help get more vaccines and medicine and things over, because this is a global pandemic. This is not a personal patent involved thing. I feel like it needs to just be out there, and we're all connected. And I think that's one of the things that has been shown true so much this past year, of just how connected we all are in so many reasons. And this is just one more thing where it shows we just need to treat this as a global thing. And things are getting better. We are, just here doing whatever they are asking us to do, and confident that things will continue to get better. And we can't wait to get back there. We're missing our trips and our visits. Zoom is great, but we can't wait to hug everybody and get back there. And so that's where we are in India. Different. Let me know if you have any questions.
Thank you, Kelly. We will open it up to questions now.
Okay, I have a question. Can everybody hear it? Can you hear me? Okay, so one of the things both Kristen and Kelly that I thought of, you know, you're kind of sharing two sides of the coin almost. But you know, what have you and your companies, maybe your artisan groups, what have you learned from the pandemic that you're gonna maybe has it changed how you do business, or what's something maybe that you're going to carry forward once the world, quote unquote, gets back to normal? I guess does that make sense?
Mm-hmm.
It does. So much of what we learned was more of like this reinforcement of, oh my God, this is why we're fair trade. This is why we do things the way we do it. This is why we operate as a family and a community, is to get through the hard times, and reinforcing that we are survivors. And once again, we made it through, you know, another really difficult thing. We did start dabbling a little bit in 2019 with getting funding, government funding, to do what we do. And I think that really helped us. We've been a nonprofit or an NGO since inception, but we've never operated in that way. And, you know, our annual donations are like, you know, 2 or 3% of our annual revenue. It's not something that we need to survive or have counted on. But we got a little bit of funding to launch a water hyacinth program, and that connected us to USAID. And so when all of this started happening and USAID was looking around saying, all right, who needs help? Who can we support? We got additional funding through them to do an initial round of masks. And then they connected us to the German government, GIZ, which is kind of like the USAID of Germany. And that brought that program to life for us. And so we've never really leveraged our status as an NGO before. And we certainly don't intend to do so for our ongoing operations, but to have those partners and to keep them close, you know, in times of global pandemics and other things that may come up. I think that was probably our biggest thing that we'll do differently, is maybe try to start using our status as an NGO a little bit more than we have in the past.
Yeah, we were super grateful that we could get the PPP loans here in the States and the EIDL loan. And Kristen and I were on the phone a lot, figuring out paperwork for all those things in the early days of pandemic. And we're so lucky we have those available to us here. And that for sure helped save us. We are not set up as a nonprofit, so we don't have that, but that seems like 100% proper course for global mamas. And yes, as far as different, I feel like throughout this whole process, all it is, it's sort of just a brain exercise. And how creative can you think to stay, you know, stay here and to stay resilient and stay strong and just to keep going. We have worked with other countries in the past with different artisan group partners. And I think this was a bit of a, you know, maybe a call that maybe we should start expanding a little bit. We're going to stay 100% with our current partners and keep growing and supporting them. But I think at this time, it's maybe given us like, oh, maybe we should look at some other groups that we've kind of talked with in the past, but we've never made anything happen. Maybe now is a good time to start doing that. So that's probably the one thing that we're looking at, but it's not going to be one or the other. It's going to be, we're continuing what we're doing, but we're also going to be adding on a little bit too, just now, because now is a good time to do that. And there's just so many groups out there that need support that we think this might be a good time to start investigating more of those. So, yeah.
I have an add-on too. I don't know how you guys feel about this, but that was a hard question because we haven't had time yet to stop and reflect. Like, I feel like since last March, it's just been, and every day there'd be new information and something would shift and something would change. And I mean, every day it was just like that. And I feel like even now we still haven't caught up. Like we fell really far behind in production because of the masks, and we weren't prepared for the demand that we're having so far this spring. And even though we're not, back to where we 100%, like, I don't know, like, are you guys slowing down or calming down a bit? Like we have not reflected or considered everything that just happened to us.
Yeah, no, especially because we thought we were coming out of it. So we were like, it was like the double hit, right? Like It was all the trauma of last year. And then all of a sudden we thought we were coming out of it. And then all of a sudden the second wave hits that we were not expecting in India, they were not expecting. And so now since then, the past 2 months, every day has been like another daily crisis and not quite sure what to do and how to handle it and how to be supportive and how to keep things running here. And so I feel like we are still kind of in the midst of the crisis, 100%.
Joan, what about you guys? Have you recovered? Are sales back to normal? Have you reflected on what you've learned?
Sorry, I lost my unmute button. I don't think we've done a lot of reflecting on, probably not in the same sense, but it's been like day-to-day survival and trying to figure it out. This is one of our new initiatives to take our education program virtual. So, it was one of the things that, trying to, I guess, remain relevant and keep Pat employed and that sort of thing, where we can offer some of our regular programs in a different format. Our sales have bounced back here. The last couple of months have been really good for us. So we're hopeful, cautiously optimistic, as they say.
I hope you didn't mind me throwing a question at you. While we wait for Joan to come back, I'm going to say to you, Kelly, that
Joan froze.
Joan's frozen.
I can't believe that I felt like Ghana and India were in the same place, like up until March. And I wish I could.
Were.
We were. And I still, we're constantly knocking on wood, and we're not sure if what happened there is going to happen in Ghana as well. And I'm just thinking about you guys a lot.
Thank you.
And your producers.
Yeah, it's again, the past 2 months just feel like the worst of the whole thing. And they are in so many ways. And it was just when we all thought we were coming out of it. Yeah. That's been the thing. But it sounds like Ghana, with their history with Ebola, they were a little bit, they maybe knew what to expect, or they were able to put those things in place early on, which sounds like that made a huge difference. And they didn't ease up either,
But it is easing up now. And it's the worst time for it to be easing up with these new variants.
Right. We just need more vaccines. Like that is 100% the answer. Like the international community just needs to get vaccines out there to as many places as possible.
We've had one mama vaccinated.
Oh, wow.
So that there was an initial COVAX deposit of vaccines in Ghana about a month ago, and then they haven't received anything since.
Yeah.
Wow.
Yeah.
Kelly, what is are your artisan partner able to access that? Is there any vaccine in India?
So it's there. It's just there's still really few and far between. I think the last numbers I saw were maybe 5 to 7% of the population has been vaccinated. And again, we're talking about a 1.4 billion population. So that's a lot of vaccines. The the teams, the head teams, the office teams of the artisans, a couple of them have gotten like maybe the first vaccine, and they're trying to stay in touch and stay on top of where vaccine distribution is going. Everyone's hopeful they should have, more in the next couple of months. They just hope the vaccines get there before a third wave happens, really. So it's really just hoping to get more and hoping more start, because so many, I think, are produced in India. They're just really hoping to ramp that up, and hopefully with the easing of some patents of things on them, they'll be able to get more out there. But it's just slow going with the sheer volume of population that they're dealing with.
Are they still exporting most of their vaccines that they produce?
I don't know the total percentage. I know that they do have a lot of facilities there that would seem to be able to be converted into vaccine production, especially for local. I just hope that's the case and that it happens sooner rather than later. So, yeah.
Beth, do you have any questions for our panels?
No, it's funny. Ron was just talking the other night about trying to get oxygen concentrators to India. They have customers in India, and they make them in China, and they just don't have any to sell it. And he'd love to be able to sell them, and they just don't have any. They're at full capacity making oxygen concentrators.
Mm-hmm. Well, if there are no other questions, I do thank you both very much for taking time to prepare and to join us this evening and share your information and the experience of your organization, as well as the artisans that you work with to have their product in our store and to support them in a small way that we are able to learn about that. So thank you all so much
Thank you.
with us tonight and just sharing all the good news. And I just really appreciate you from a personal standpoint. I appreciate our partnership and the mutual support that we can offer each other. So thank you very much.
Thank you.
Thank you.
And this recording will also be available. We do have a YouTube channel. So once it's processed and edited, so you'll be able to go back and look at what you said. And if you would like to share snippets with anybody in the future, of course, we would love that to happen too. Thank you so much.
Great.
Thank you.
Thanks for having us.